4 years after artificial intelligence became the next big thing, we're still trying to grapple with its impact on our personal and professional lives. Those of us in academia are particularly interested in not only how we teach and work, but how our students learn. While most of the focus has been on how they may be using the technology for nefarious purposes, there's also been exploration about how students are using AI to supplement their learning, either as a study tool or as a way to more deeply explore a topic. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. Recently, Dr. James Wheeler, Associate Professor, and Dr. Carl Kodweis, Assistant Professor, both of UTHSC's College of Pharmacy, presented a poster titled Use of Generative AI on a Drug Information Project, Curricular Tool or Cheating Fuel, at the annual meeting of the American Association of the Colleges of Pharmacy. James, welcome.
Thank you for having me, Tom.
Glad to have you here. Carl, welcome to you.
Well, thank you. I appreciate it. Far trip.
I'm sorry?
Far trip.
Far trip, yeah, across the street.
Yeah.
I'm really excited to talk more about this poster. As we all know, AI is a big thing right now, and we're really interested, especially about how students are making use of this. So I thought your poster was really timely. James, can you start us out and just briefly summarize the poster and why the topic is important?
Absolutely. So I'll back up for just a minute and tell everyone a little bit about the course that we teach in. I coordinate a course in our PharmD curriculum that is called Information Technology and Safety. And so one of the things that we do in the course is teach and assess drug information skills as well as evidence-based medicine skills. And so the research from the poster came from an assignment that I've had students do for the past several years where they're assigned a formal drug information project to work up. With the advancement of AI, we noticed that, and it is likely that students will use AI software to generate responses for drug information questions or other types of assignments. And so Dr. Kodweis and I kind of brainstormed a little bit about, well, instead of creating rules where they can't use it, why don't we empower them to use AI appropriately through prompt training? And so that's what a little bit of our research focuses on from a student performance perspective, is looking at training on best practices for using AI, for using it for drug information response purposes.
It's all kinds of discussions going on across the world right now, aren't there, about how we can, rather than fighting the AI and knowing that students are going to use it, but how do we lean into it and use it to help them become better learners and better professionals after they leave here. So what were your findings?
So our main finding was that we looked at performance on the drug information activity and looked at three different categories. And so the three categories that we looked at were, first off, AI knowledge. So kind of understanding the terminology, the main concepts of AI literacy, and that was assessed via an assessment kind of to look at how much do students know about this topic. And then we also looked at their AI readiness using a validated tool that was used in medical students that looks at AI readiness. And then we looked at more of a group dynamic relationship where the percentage of those in the group that had prior AI use, so it was kind of more of a dichotomy. So it's people who had used it and people who hadn't. Does a higher percentage in a group of people who have used it, does it promote or give a better advantage on this assignment or promote a higher grade in the end? We did a linear relationship between all of these factors, and there wasn't a huge difference between those who were AI naive and AI competent. And so our main finding here was that regardless of where students are coming in from when it comes to teaching AI, it's still something that we can teach in the classroom in a way that's structured, designed appropriately, and kind of gives them the framework to then apply. And I think that was a strength of the study, was kind of teaching them how to do it before putting them into the throes of it. And so I think that of those three factors, so the knowledge coming into the project, their readiness to kind of engage with the topics, and then the percentage of the group that had AI experience, none of those were statistically significant in promoting a higher grade on their final assessment, kind of alluding to baseline assessment of AI really doesn't matter when we go into the classroom, as long as we teach it, we instructionally design it appropriately, and we can kind of look at what do we want students to get out of it and design an intervention or a assignment that then promotes that.
So, one of your assessments, you asked students to rate themselves on 3 questions. The first one was, I feel confident in my ability to use generative AI. And the second one was, I believe generative AI is an essential tool. And then the last one was, I am aware of the limitations and potential biases of AI. And it was interesting because there's a pretty even distribution amongst that scale of how students responded to themselves. What do you read into that?
I think that what we find there is kind of reflective of what we see in just a general society, right? Like we know that these systems have been out. I think ChatGPT came out in 2021. And so we're still in this new age of what it looks like. And so there's a lot of information being circulated about what these systems can do, what they can replace or augment in the working force. And so I think in terms of all of these, a lot of the findings, at least in the frequency of responses, we're kind of in that middle category, right? And so I think people are knowledgeable when they spend the time and dive into the topic a little bit more, but are kind of a little bit more hesitant to dive into the weeds on these programs if they don't know really where to start or how to kind of look for it. And so, in terms of the confidence, the perception, and the awareness of the limitations, there you're right. It was kind of a grab bag across the spectrum, but the middle of those Likert scale, so like from the slightly disagree to the slightly agree, those were kind of where the majority of the responses were. And so, yeah, you have some that are extremely understanding and know and competent about the AI systems, but then others who have never touched it. And so I think that that just shows the dichotomy of where we're at. If we were to extrapolate that out, even the general population may not have had, like, unless you're a student who's probably using it, like our responses kind of highlight, you may be less likely to engage with the software for fear of not knowing what it can do or what it does.
It's also easy to forget that this thing's only been around for 4 years and has changed so much. And so also it doesn't surprise that there's such a range of responses on those questions as well.
Yeah, it definitely requires a growth mindset. You can't go in there saying, "Oh, I know AI 1 month," and then completely, a month later, you know, a new model gets dropped or, a new program comes out that we can use. So yeah, it's rapidly advancing. I think that right now the responses show a healthy knowledge of the software, the limitations and all that, but it's not as strong as it can be. And I think that that does play a factor in it where we just don't know what the AI systems will be able to do tomorrow.
Or the next hour.
Or the next, yeah.
You also had a really interesting table on your poster about how students are using AI to study. There was really interesting responses on that as well. Can you talk a little bit more about how students are using AI in their academic work?
Our students are using it for a number of things, for note taking, for developing practice questions, for writing reflections, for writing essays, even things like scholarship applications. And so it's really run the gamut. I mean, we've had students kind of on the bell curve who some don't use it very often or use it very minimally. We have others that use it who are writing songs with their friends on it. And so, I mean, probably reflective of society as a whole. But the other thing we're noticing, and this is consistent with the literature over the past couple of years, that it is growing. It's growing pretty rapidly. And so we see our students use it quite frequently, many on a daily basis.
I I was talking to a student in medicine last month, and he was talking about how he was using it to not only develop flashcards, but also to write case studies. And medicine students, that's all they want is more and more case studies. And I imagine probably pharmacy students as well. And so doing things well beyond what we as instructors are providing to our students for their studies.
Well, and that's where I think the benefit of the software and the programs is where it, up until now in education, we've tried to have this one size fits all when it comes to an instructional design of a classroom, right? Where some students may have deficiencies in certain areas while others may be proficient or vice versa. And so I think that what AI kind of helps and what the promotion of these systems allow is more of an individualized approach to education, and kind of learning. And so that's kind of what our main findings in this area were, where they're using it a lot for school related tasks, but they're not using it to cheat. They're not using it to skirt assignments. They're using it as a way to augment what we're already going through in class. And there are issues related to intellectual property and kind of what gets used to train the systems. And those things are still being kind of discussed. But I think that what this shows is that our students are already using it and they're using it in the setting that we're teaching them in. And so why not teach them the right way to use it as opposed to just say, let's not do it, you know?
Yeah, I love that idea of thinking about how students are using it to create personalized educational experiences. Right, because as educators for a long time, that was a challenge for us in the classroom of 100 people. How do you meet the needs of everybody sitting in that room? And now students are using it as tools to take that on themselves.
Well, and I mean, how many times can you answer the same question from a student, whereas the AI bot, it'll do it every day and many times as you ask it. And so it's kind of taking more of a personalized approach to the students' like needs and what they need from the kind of material.
Yeah, I think Carl makes a great point, and that's as we as an academy, we're thinking about things about like competency based education, for example, and how would that fit in future delivery models. That's easier said than done, but one of the things AI can do is obviously it's a tool that speeds up things greatly, and so if you do have this individualized approach to health sciences education or a greater individualized approach in the future, AI can really augment faculty members' time and efforts to make that possible.
In your poster, you raise a question as a pedagogical concern. You say that do AI literacy activities enhance critical thinking or do they risk promoting academic shortcuts and dependency? So, what are you thinking at this point?
What we found was that intentional structuring and design of the educational intervention is required in order to do something like this, where you have students that have varying levels of AI proficiency and understanding and competency. And so, what we found was that those who were extremely familiar, extremely knowledgeable, or even in groups that had a higher percentage of people who had used AI, we didn't see higher scores in that group compared to those who didn't in any of those areas, which I think signals that we're kind of bringing everyone up to a certain level as opposed to kind of dividing that even further, right? Like if we can spend some time pedagogically or methodologically in the classroom, teaching them the proper way to do these things, structuring it in a way using, a validated rubric or a rubric that, kind of assesses the right things. I think that those factors play into the overall idea that we can bring even those that noted, "Hey, I have never used AI before," it wasn't a hindrance on their performance on this assignment. And so I think that going into it, having a clear directive of what you want students to get away from their integration or implementation of these software programs, I think is on the educators. That's what they should kind of look at from a pedagogical perspective.
So, one of your main findings suggests that structured prompts, standardized rubrics, and collaborative group work may have compensated for the differences in AI familiarity. Does that mean at the end of the day, it all still comes down to good teaching?
I think yes. I think because these systems, they're designed for the general public, right? And so if we want to use them in a specialized healthcare education context or in a specialized pharmacy or medicine or nursing context, you got to add that lens into the equation and not just completely skirt it because at the end of the day, we don't want to have these systems completely replace us, but we want to augment our ability to do the best care for our patients, right? And so with that, I think that you'll always need the human in the loop and you need to be a good educator in order to kind of structure it in a way to promote these ideas and these practices with engaging with the topics and software. Even if you're an educator who is very naive or very limited with your understanding of these programs currently, spending the time to go and explore them, kind of see what they can do, what their pros, what their cons are. I think in telling students, hey, I'm learning this at the same time you are, I think is a very valuable relationship to have with the students as a way to kind of show that we're all learning together. And I think that having the human in the loop and having the instructor kind of still there versus just like a self-directed activity where they do it on their own, I think that showcases that, these systems are coming out, they're going to revolutionize it, but we shouldn't look at it from a singular person controlling it, but more so, how do we look at it as a group?
One of our instructional consultants has started using the phrase human curated, AI enhanced. And I think that's just the way you were just talking about right there is that, you always need the human element to really take a look at what this stuff is pulling out and
Well,
building on it.
and that's the interesting piece is that whatever you ask these programs to do, it's going to try to give it your best response to it, right? And so you run into issues where it's generating false information or inaccurate claims or it's misinterpreting things where, if you're in a different field that doesn't, maybe a non-healthcare related field, something like that may not have as dire consequences in the real world. But if we're using it in a patient care context or we're using it in a context of the healthcare setting, without the human in the loop, and if we were to just trust these AI programs, then yeah, we would run into significant issues with these patients that, rely on our expert judgment to make the best calls for them where they're at. So I think that, yeah, I think you'll always need to have that human in the loop, but I do like that AI. What was it?
Human curated, AI enhanced.
Love that.
So, College of Pharmacy is going through this huge curriculum renewal. And I've talked to lots of people and say that we need to have this in the curriculum and this needs to be part of the curriculum. And laws are changing. So we need to make sure we're talking about this and we're talking about that. And I mean, at the same time, there's pressures to reduce the amount of time it takes students to get through school. And then you have standardized tests that students have to be ready for. So how do you fit AI literacy into an already packed curriculum?
Well, I think a couple of things. We introduced it early, and I think it's collaborative in nature. So let's just take a few, let's take some of the examples, some of the library resources that we have available. So Up to Date, a very popular resource among our students and faculty, now has a generative AI component to it. Same thing with Open Evidence. I mean, it's got millions of healthcare professionals. It's one of the fastest growing companies in the United States right now. And so I think we just try and build it in early and maybe intentionally with other things we need to focus on. So evidence-based medicine and drug information principles is one aspect of that. But I think there's so many uses that you can help augment it. And it's just even simple things. I mean, students have questions about how do I cite when I used AI, for example, or how do I disclose that? Or should I disclose that I used it for this presentation I'm giving at the pharmacy department, for example? Like those kind of things are coachable moments and things we can instill early in our students to make really improve activities and presentations, but also protect students in a way.
I think that it's not, we're going to teach an AI elective at this point in this semester and this year. I think it's more so how do we bake it into what we're already teaching in a way to then, yeah, augment what the students are already doing. Because I mean, when we're talking about learning just as a whole outside of AI, being able to analyze, create, and to kind of evaluate things is kind of the highest level. And so if we can teach a concept like something like a medical note writing, like a SOAP note, and have the student write the first draft of the SOAP note and then ask AI to evaluate it or generate a similar type of note, are they able to see those areas where it doesn't have that perfect amount of detail that they had in theirs, or areas where it condensed things where they probably could condense it? And I think that instead of just having you write the SOAP note, give it to the instructor and ask them to grade it, having them have a step in there where you put it into an AI chatbot, ask it more feedback related. What are some things that, you would change, things you wouldn't? I think that part of the educational process targets those higher levels of Bloom's taxonomy, which we want students to have at the end of their 4 years. And so I think that over a 4-year or 3-year curriculum, those things can be built into, yeah, drug information, citations. I've been trying to find a way to do math-related tutoring on it because students coming in are struggling with basic foundational math principles, but that's one of the limitations of some of these systems is the math functionality isn't there. So there's a bunch of ways that we can implement this into the curriculum as a augment or an adjunct, not a complete new lecture, new class, new series of sessions. Yeah.
Again, this stuff's only been around for 4 or 5 years. As we start getting students who have had it all through their undergraduate careers or started using it when they're in high school, how those conversations about AI literacy change. And because students will come in with more experience and more understanding of how this stuff works. And so it may be the conversation has changed not from this is how you use it, but this is how you use it well, or more help on developing specific prompts, not just general prompts, but more specific to pharmacy or things like that.
Well, and that's what's interesting. So ChatGPT was kind of that major inflection point, right? That kind of brought the general public into this. But AI systems like LLMs or large language models and others have been in practice for a little bit, in the computer science realm, right? We just didn't kind of come up with it overnight. And so I think that some of the principles in that literature side of things kind of can help direct our literacy education efforts. So we're not starting from zero, but it's still new for everyone. And so it's trying to figure out what is the best way to do it. And I kind of see AI literacy similar to health literacy, right? Like there's different levels of understanding, different things we got to look at. And so I think that's a positive when we're talking about kind of bringing it into the 21st century and using it effectively.
The other thing I'll point out to build on Dr. Kodweis' comment is that, if we look at employers, if we look at health systems, they're all building AI tools into their operations. And so the major electronic health record companies, for example, now have AI applications built in. And so really we have to be training our students for this because they're going to be expected to use them on internships, on rotations, during residency, those kind of things. And so really it's an adoption industry wide, not specific just to education. And so this is kind of the first step of early in our curriculum, giving students exposure and training to get them ready for more advanced roles in practice.
So you've done this study, and my guess is you're probably going to continue to look at this data and revise it and ask more students. But what would you recommend based on these early results to other pharmacy programs?
And so when we're talking about what other pharmacy curriculums can do, I mean, every day there's a new paper that comes out investigating the use of AI-based intervention in the classroom setting and ways that we can use it as a tutor, ways that we can use it to help draft assessment-related questions. And so I think that wherever we can fit it into the curriculum by kind of tying it back to those AI literacy principles, I think is where a lot of these pharmacy programs should kind of direct their efforts, where how do we teach these students how to integrate these processes, how to use them, how to evaluate them, as opposed to just teaching them one specific program or in one specific use case. I kind of use the analogy that it's similar to the computer or the cell phone, of the early 21st century, right? Where we don't use it just to call or we don't use it just to text. We use it for a multitude of different purposes. And so when we're talking about bringing it into the educational context and in the field of pharmacy, there are some ways that it's being investigated of how it can be useful in the healthcare setting, whether we're talking about operations or in the community setting, helping with medication therapy management. We know that there will be a benefit, but the benefit hasn't been expressly noted. And so by focusing the AI education in a specific area, we're doing our students a disservice. By focusing more on a broad, here's how you use it, here's more AI literacy based principles, I think pharmacy programs can help build that competency and that literacy of these systems. That way, as Dr. Wheeler was saying, when they get into the working world and they're expected to use these systems, they're not just saying, well, I only used it in the up-to-date context where I can only look up a drug information and use it in that one specific use case, where, like we talked about, these changing every day. It'll change by the time we're done with this podcast. And so if a new program comes out that's completely revolutionizing the practice of pharmacy in a specific area, then the AI literacy based principles will hopefully translate into it, allowing our students to kind of be more comfortable with using it from the get-go.
And some of the things that you're talking about is not pharmacy specific, right? The same concepts about preparing students for a world when they leave here that's going to be steeped in AI, whether you're going into nursing or occupational therapy or medicine, same principles that you've been talking about still apply.
Yeah. And I mean, that's where we're seeing it in at least the emerging literature and kind of all these health systems. We're seeing all these health systems adopt this technology, like Dr. Wheeler was saying, into their EHR systems, where pharmacy isn't the only one who touches that EHR system, right? And so we need to figure out how does a nurse use AI within an EHR, or how does a physician use it? And those use cases may have similar practices, but based on their own disciplines may differ significantly, right? And so, yes, a lot of these AI-based practices are important to teach as a standard or just healthcare education. A pharmacy needs to focus on this specific use case of AI. Medicine needs to focus on this one. These practices can totally be applied and tailored to specific discipline, operational or workflow, but also from the interprofessional education sense, communication in healthcare is key, right? And a lot of the large language models and the generative side of this is helping with more of the documentation, the communication aspect of things. And so with that, I think that we can hopefully start to see where those areas in current practice may have kind of gaps or due to things being dropped or not being followed up on. AI can kind of come in and kind of act as a safety net. And I think that in the interprofessional sense, it has some merit as well.
So what's your next study?
We're going to keep going. We're going to see kind of what we can do. This was an initial pilot study. Can we standardize a group coming in to then allow them to use AI on an assignment and to see whether or not that had an effect on their overall performance? But going forward, what I think Dr. Wheeler and I want to look at more so is individual competency and comfort with it, where what we looked at here was group performance data, right? So there was 20 groups, 20 grades, and we looked at an amalgamation of data within each of those kind of pillars, but it was all from the group perspective. And so going forward into this next run in the spring of 2026, our goal is to use a individualized approach. And then the other kind of limitation with this study, when we gave it initially, was we didn't do a post assessment after the activity. And so I think that being done after they turn in their assignment to see what are the changes from baseline, because there's a couple weeks in between when the session was held and when the items were due. And so there's a little bit of time in between there to kind of allow for longer period to assess whether or not these skills are retained. But I think that from the individualized perspective, looking at their knowledge, their readiness, and kind of their grade performance, this is kind of where we want to direct it.
I'm always interested in trends. And we talked a little bit about how the students that are undergraduates now or high school now, when they come to us, how they're going to be different. And especially this one with the AI readiness questions, how that changes over time, or even how students change how they're studying over time as new tools are developed and how they get more comfortable with the technology.
Well, and yeah, we see that with a lot of these technology advances, right? Where, I mean, they're teaching AI literacy-based principles in K through 12 education already. And so by the time they come to sit in my first year pharmacy course, they're going to be teaching me things probably in a few years. Not that I won't be trying to keep up with it and being all that stuff, but I mean, when you're that young and starting this process from that age in those developmental years, yeah, we're going to start to see more of a trend where a lot more people are going to come in with experience using it because it's going to be a fabric or a staple in their educational process up until that point. And so, yeah, I think it's exciting. I think the jury's still out on what the final abilities of these softwares will be, right? Because it keeps changing. And, at some point, hopefully, we kind of get more even keeled and more predictive type of performance on things where we're not changing it every day. Seeing the kind of emergence of this type of curricular intervention when we're talking like K through 12, I think is going to, it's going to ripple all the way through. And when we say they're going to be more expert than we are.
All right. Well, thank you both for your time today. AI is just changing the world in many ways that we can't anticipate, and a lot of ways that we can't anticipate. So I think keeping your finger on the pulse of how the students are coming to us and using this for their own work, and I think it's just going to be fascinating. So thank you both for your time.
Thank you.
And that is this month's episode of Teach Well, Learn Well. I'm Tom Lochner of the Teach Well Learning Center at the University of Tennessee Health Science Center. Until next time.